Hello, I'm David R. Jones of the Community Service Society. On this episode of the Urban Agenda, we continue a discussion we began last month about the complexities of the managed care healthcare system. I'm joined today by a studio audience made up of healthcare consumers and consumer advocates, and answering the many questions they have are two managed care experts. Chris Molnar is the director of the Managed Care Consumer Assistance Program, which is based at the CSS offices and provides training and grants to community-based organizations. And Joe Baker is the executive vice president of the Medicare Rights Center, an advocacy organization working on behalf of Medicare beneficiaries. Welcome, all of you, to the Urban Agenda. Well, we'll start with you, Chris. What is this about mandatory managed care for Medicaid consumers? It's not, they just can't choose what the people want, right?
Well, yeah, you know, it's something we've been talking about for, seems like a long time now. About 5 years ago, the conversation started. But what it is for Medicaid beneficiaries in New York City, as of the last couple of years, people are starting to have to join a managed care plan to get their Medicaid services. And it's happening by zip code. So depending on where you live in the city, you'll get one of these envelopes. It's a white envelope, which says you have 60 days to choose a plan. And if you don't choose a plan, we're going to assign you to a plan. But because there's this very complicated process of choosing a plan, many people who are not mandatory are getting a yellow envelope. And a yellow envelope, not to be confused with the white envelope, says, hey, managed care's out there, you should join if you want to, but you certainly don't have to. But, you know, it's a very scary thing for many people because it changes how you get your services. And so folks are getting these white envelopes and not knowing what to do about it and are being assigned to plans, and we're seeing that a lot.
What about most of us who throw out things that we don't know where it's coming from as junk mail? What happens when people don't even receive the thing? Or the post office never delivers? In my neighborhood in Bedford-Stuyvesant, I get a 50% delivery rate if I'm lucky. Most of the mail is misdelivered.
It's a very, very big problem. If you, for some reason, don't get the mailing and it has been sent to you, you may get assigned to a plan. And that has happened for people. And people who've thrown it away, similar things happen. There are reminder notices. They come out after you've been sent this. You get another notice in 2 weeks, etc. But it is a big problem relying on the post office. My greatest respects for the post office. But it does, it does cause problems.
Joe, we've just been through an election campaign where the discussion of Medicare centered around prescription drugs. What is the debate on prescription drugs and Medicare?
Well, as you know, prescription drugs are not covered by Medicare, and it probably is one of the greatest expenses, people with Medicare, people over 65, people who are disabled, who are on Medicare have. So both presidential candidates had come out with plans. President-elect Bush now will probably put forward his plan, which is a state, some money going to the states for them to do programs that would cover prescription drugs. Fortunately, here in New York State, we have the EPIC program, which is available to middle-income seniors. If you're a single person, you have $35,000 in income, a couple with $50,000 in income, you can get this subsidized drug program through the state. It's called EPIC. The other thing that people are doing are joining Medicare HMOs because they can offer now a lesser degree of drug coverage. But as you've also probably seen in the news, more and more of the Medicare HMOs are leaving the Medicare market, dumping people, you know, off of the program and back into the original Medicare program, which still does not have prescription drug coverage. So the drug coverage issue is going to be with us for a while. Fortunately, we have EPIC here in New York State, and that has been enhanced this year, so people really need to look into that.
We're now going to turn to our studio audience for questions or comments about managed care. We begin with Andrea Ryan from the Urban Justice Center. Andrea?
I work with people with mental illness who are also homeless or low income, and we have seen a lot of difficulties in accessing mental health care in the managed care programs, both in Medicaid and in Medicare. Not only is it a difficulty accessing services, but also experiencing limitations once they do, in fact, access those services. I would like to just urge people, and first of all, make people aware, but urge people who do have mental illness that they can get an exemption from Medicaid managed care. And if they need assistance doing that, the Mental Health Project at the Urban Justice Center is there to help them. And also, if they do in fact find themselves in a Medicaid managed care plan and are having troubles getting their mental health services, that they can disenroll based on the fact that they qualify for this exemption.
Joe, do you have a comment on that?
Yeah, I mean, we're also seeing a lot of problems in the Medicare program with, coverage for people with mental illness. First of all, the original Medicare program, which is the government-run program we've had since 1965, only covers 50% of the cost of your mental health services on an outpatient basis. And that can be a pretty heavy hit for people with mental illness. That's why a lot of people with mental illness spend down their assets and income to also qualify for Medicaid so that they can have coverage from both programs. What we're seeing in the managed care area is that people are signing up for managed care plans thinking that they're going to be able to get mental health services from a broad range of doctors that might be listed in the book, or hospitals or other outpatient facilities listed in the book, then getting into the program and finding out that there's a behavioral management service that's been told to subcontract and make sure people go to this doctor or provider or this set of providers as opposed to the whole list. So my advice would be, if you have a mental health need and you're seeing providers, you definitely want to call the HMO and say, what are you going to do for me? Who am I going to be able to see? My current doctor, these doctors, are they available on the list? Call those doctors individually to update that information. I mean, it really does mean spending a little bit more time, but it's well worth it.
Chris, do you have any follow-up on the Medicaid issue in mental health?
Well, I think that there isn't that much to add. It's not a program that's meeting people's needs, and I think it's all the more reason, particularly with people with chronic mental illness, to have as an ally their provider and make sure that providers help to get them out of managed care or to write those exemptions, and talk to your provider about getting out if you find yourself in your health plan.
Our next question is from Rick Starr, a Brooklyn resident. Mr. Starr?
Hi, thank you. A couple of things. I have my insurance through an individual HMO plan, but I'll also be Medicare eligible in a few months. I'm not sure what the interplay is going to be between when I do get Medicare and the HMO that I'm using. And since the HMO is meeting pretty much all of my needs right now, will I ever have to use Medicare at all? And will I also need to go into Medicare HMO plan? Basically, are my questions.
Joe, this is your field.
Well, this is a great question because many people are facing this. They're in a private individual plan and then they become eligible for Medicare, or they're working and they become eligible for Medicare and they say, oh, what am I supposed to do now? Basically, once you become eligible for Medicare, and in your situation with an individual plan, Medicare becomes your primary insurance. And that plan that you've had up to that point, the private individual plan, becomes secondary to Medicare. Now, what that may mean is not a lot of change in your health care coverage, because many HMOs coordinate with Medicare very well. And so therefore, you'll go to the HMO doctor, you'll pay your copay, and behind the scenes, that HMO will send a claim to Medicare. What you're going to want to do before you become Medicare eligible and get on Medicare is talk to your HMO about how they're going to coordinate that coverage. And if there's any problems with that, you can call us or the CSS program, the MCAP program, and we can help sort that out. I think the one thing that you need to be reassured about is that you do not need to join a Medicare HMO. Do not drop this individual coverage that you have, because it is much more generous, much more comprehensive than any Medicare HMO coverage you could ever get. So keep that coverage, go on to Medicare, they'll work together. The great thing is you've got good prescription drug coverage that you just can't get out there right now.
Just to give the audience some idea, if you don't have prescription drug coverage, the cost of drugs in this city and, of course, nation is huge.
That's right. It is probably the biggest cost, that after long-term care, which affects, people that need to go into nursing homes or need to have home care at home for long periods of time, which Medicare doesn't cover, it is probably the biggest expense that most people on Medicare face. And there are discount drug programs out there. There is Epic out there. Really give us a buzz at the Medicare Rights Center and we can walk you through some of those programs.
We have another question, and as you know, obviously managed care doesn't only affect adults, it affects young people, and we're pleased to have a question from Daphne DeBornay. She's a 15-year-old resident of Brooklyn. Daphne, your question.
Hello. If I need to get birth control or HIV STD testing, am I going to be covered, and also does my parents have to know?
Willie. Chris.
That's a really excellent question, and a lot of people are concerned about that. If you have health care through Medicaid or Child Health Plus, which is a program that you can get up to 19 years old, it does cover birth control, it covers STD testing, it covers HIV testing, and all of that is confidential. You don't have to be, you can go anywhere you want with your Medicaid card. You don't just have to stay within a plan, and your parents do not have to be informed. Even if you go to Planned Parenthood, of course it's going to be confidential, but any family planning place should be confidential.
Obviously, one of the concerns, there's been a lot of pulling and shoving over what publicly supported plans can tell people and what they do with young people, but clearly in the New York City area, this is critical for us. If we can't have these kinds of honest discussion between a doctor and a young person, this could be really horrific.
I just want to add one more thing, which is important about the family planning piece, which is not every plan is going to have in its list a family planning provider. And if you're on Medicaid or in Child Health Plus, that shouldn't matter, because you can go to any provider in the Medicaid program and get family planning. But some of the Catholic plans, Fidelis is one here in New York, that they just don't, for reasons of conscience, offer that program.
Okay, we'll be back to continue our discussion right after this.
You don't have to like me.
Or you can.
You don't have to be my friend, but you might like me
if you got to know me.
You don't have to be my roommate.
I am gonna be your neighbor.
you don't have to run with me.
You really don't have to run away from me.
You may not like what I have to say,
but hear me.
Hear me.
Hear me out. And we're not all that different. I like good food.
Good music.
I love my mom. Yeah, I want to fall in love.
Madly.
I want a good job.
I want my kids to live in a world
where they are safe and loved.
And respected for who they are.
You don't have to like me, but if you talk to me,
You might.
we can end prejudice if we talk to each other. Call.
Tell us what you do.
together we can build one America.
Welcome back to the CSS Urban Agenda. I'm David R. Jones. Our topic on this special edition of the Urban Agenda is managed health care. Our next question is from Shira Samaroff from the Women's Housing and Economic Development Corporation.
I have a comment, actually. I was helping a woman who had took her youngest daughter to a health clinic that she'd been taking her family to for years and discovered that this daughter had been assigned to a health plan that this clinic did not cover. She had no idea how it happened or that her daughter had been assigned to a plan, and she just happened to tell me the story, didn't even realize that she had any other options other than just to find another doctor. She didn't know that she could disenroll or change plans, and you know, sometimes health plans make mistakes or aren't fully aware of the rights of their consumers, and I just think it's really important for people to know that they can question the decisions of their health plans and need to know their rights.
Thank you for that. Joe, maybe you have an additional comment on
Well,
this issue.
I think, you know, in the Medicare program, there is no mandatory managed care. But once again, we do get a lot of people signing up for a plan, not knowing where to go, going to the wrong doctor. Once that happens, there's a couple things that we can do. We can get them disenrolled from that plan and get that care paid for by the government-run original Medicare program. It's called retroactive disenrollment. Or if that plan isn't working for them because their provider is not in the plan, we can just simply help them enroll in another plan that might be more appropriate and that might cover that provider. So there's a lot of different things that we can do. We can also appeal the denial of care if that's appropriate. If in a situation maybe a little bit different from the one you described where care was denied or care was otherwise not given because there was some confusion or because they felt it was not medically necessary, there are very good appeal processes within the Medicare program that people can use, and we can help them access them.
Just give a brief idea of what the appeal would be like. Do you have to go up before a panel or a judge, or what do you do?
No, it's very, very straightforward. It's very easy. All you really need to do is to call the HMO in this situation and tell them that you want to appeal a denial. If you haven't received anything in writing, you call them. If you have received something in writing, all of the instructions are on there. Sometimes you don't even have to send any paperwork in, although we always help people send paperwork in because that can help bolster their case, a doctor's letter saying they needed the care, etc. Once again, you can do it on your own. It's very simple and straightforward, but you can also call us and we can help walk you through it or help out in other ways.
Yeah. Chris, do you have any further comment?
Yeah, I think one of the important things about complaining to a plan or filing a grievance to remember is everybody in managed care has those rights and has the right to appeal a plan's decision. And there's here in New York State an external review outside of the plan that people have the right to as well. But another important thing for people who are on Medicaid is the right to a fair hearing, and that's only in Medicaid, that if you do in fact get denied a treatment or your treatment is reduced, you can request a fair hearing, which would go to administrative law judge to make a decision. And that's again outside the plan and an important right that people know to have.
Do you need a lawyer to do the administrative?
You don't need a lawyer. You can do it yourself, or you can call an advocacy organization to get help. Legal Aid Society does a lot of that. A lot of the advocacy organizations will help go with you and represent you if you choose, but you don't have to.
Our next question is from Maria Madrid. She's a Brooklyn resident. Thank you. It's quite all right.
I'm up here at the AIDS Services Center in Lower Manhattan, and I work with the Latino community. I met a lot of women with no documentation papers, the immigrants, and most of them are diagnosed with an HIV or AIDS. HIV or AIDS. And last week I met a woman, she has HIV, she has a baby, her baby has the disease too. And I would like to know, is there any health care for the baby and for the woman too? Is there any health care available?
Chris?
Yeah, it is tough. We have a serious problem with health care, particularly for immigrant communities. But what's very important to know is that her child, who was born in this country, is eligible for Medicaid. And so her child should be getting Medicaid, and if she isn't or he isn't, we can help them, or they should go ahead and get signed up for Medicaid. But there's another important health insurance program which doesn't require any documentation of immigration status, and that's the Child Health Plus program. And that's available for children up to 19 years old, really at any income level. There's a sliding scale. So I would encourage her to get her children covered, and I know there's a few programs for folks with HIV, and maybe Joe.
We should talk about it's clearly a critical issue.
Sure, I mean, we've been talking about EPIC and other programs for people with Medicare, but
what does EPIC stand for?
EPIC, I'm sorry you asked that question because I don't know what it stands for, because we just call it EPIC all the time. But in any case, there are also the ADAP and AHIP programs. ADAP is a state program that is run by the New York State Department of Health that basically does cover prescription drug costs for people with HIV and AIDS, and you can have much higher incomes than in the Medicaid program. AHIP, once again, is also for people with higher incomes than the Medicaid program, and it will pay for insurance premiums. If you have a private insurance policy, it'll pay for those premiums so that you can continue to keep that private insurance policy and get prescription drugs and other care through that insurance program. So those are two programs that are specific to people with HIV and AIDS that could really bridge many gaps for them.
Of course, Maria has raised another issue here, which is the question of legal immigrants. The law that the Republican Congress and its in welfare reform passed specifically excluded them from all benefits, Chris, or what are they entitled to? What can we do?
Well, there's not a whole lot that they're entitled to, and we want to revisit that. They're not entitled to Medicaid. They are entitled to Child Health Plus, and that's a state program, not a federal program. And we're starting to see that a lot of people are unable to get the insurance that they could have perhaps gotten years ago. They've been in this country 1997 and beyond, and if they're HIV positive as well, they may be able to get Medicaid. But that is a question where we need to work, and you need to get in touch with advocates who, depending on when you came into the country, you may be able to get into the Medicaid program.
Our next question is from Belkis Dameron from the YMHA in Washington Heights.
Hi. I've been working with a person on Medicare who has been diagnosed with cancer. She's being penalized for applying for late for Medicare. I recommended her to apply for one of the programs which assists people with low budget or incomes, which is QMB and LSMB. And she went down to the Medicaid's office and to apply. Over there, no one seems to know what is the program about. What she could do.
Well, this is a real common problem that we're having. The QMB and SLMB programs, and there's also another program called QI1, Quimby, Slimby, and QI1.
Where do they come up with these names?
I wish they called it Gumby, because they all rhyme, you know. But in any case, under QI1, for example, you can have up to almost $1,300 in income a month, and the state will pay for your Part B premium, which is next year is $50 a month. So that's a tremendous amount of money to someone who's on a limited income. So we definitely need to get these people signed up for the program. Now, the point that you're making is that at the Medicaid office, frequently people go in, they talk about the program, and the caseworkers just look at them or say, oh no, you can only apply for Medicaid. And they're not eligible for Medicaid. They're only eligible for these programs with the higher income and asset limits. What people need to do really is to give us a call at the Medicare Rights Center, and we can help them do it. I wish I could say they could, you know, advocate for themselves here. We're finding that they can't. We can help. A lot of other advocacy organizations can help. And if they deserve the program and they're entitled to the program, we will get them on the program. It takes some work, but they should persist and give us a buzz.
Our next questioner is Nakia Brown from Staten Island. Nakia?
My question is, my cousin received a mandatory packet in the mail, and I believe that she's exempt or excluded. Where can she go find information about this?
That's a good question. Your cousin is obviously on Medicaid if she has to join a managed care plan. And in Staten Island, I'm reaching for my envelopes again, because in Staten Island, everybody should have received one of these white envelopes at this point. Staten Island is mandatory, everybody living there. And if your cousin is eligible for an exemption, and what that means is there are certain categories of people who are on Medicaid that may not have to join a plan. For example, if you have a chronic medical condition and you've been seeing a doctor for 6 months or more who's not in a plan, or if you speak a language that your doctor speaks your language, you can't go to any doctor that's in a plan that speaks that language. You can get a language exemption. Or if you're HIV positive or you have AIDS, you can get an exemption, but you have to apply for it. And what that means is you need to call Medicaid Choice. And you need to call Medicaid Choice and ask them for an exemption, and they'll send some forms, and then you need to go to your doctor and get help filling out those forms. But it's important, if you're exempt, not to join a plan unless you really want to.
What happens if they assign you to a plan and the doctor in your area is, I won't be pejorative about it, you don't like this doctor? What kind of options do you have? Are you locked? I mean, particularly, of course, mandatory Medicaid. Do you have any options here? What happens if you don't think they're particularly competent? I mean, being a lawyer, I know incompetent lawyers. I'm sure there are people who are not great doctors, but what do you do about it?
You know, if you're in a health plan and you've had to join a health plan, you do have 90 days to switch your health plan within the mandatory program. So you can switch if there's another plan that you think would treat you better. But you can also change doctors within that health plan. If it's just a question of the doctor, there may be another doctor within the plan that would suit you better. It's important to research those options. But then again, not every doctor is accepting new patients. So some people do find themselves caught between a rock and a hard place.
Do you have any mechanisms? What happens if you start calling all the doctors they list and they said, I'm sorry, we can see you maybe in 8 months, but we're not taking any new patients?
I'm glad you asked that question, because first of all, that's unacceptable. You need to be able to get an appointment within 6 weeks. And second of all, every plan should be able to provide you with a choice of at least 3 doctors. So if you don't have real choice in that plan, then that plan shouldn't be enrolling you, and that plan actually has reached its cap, and you don't have to join.
Joe, what about Medicare? What can people do here?
Well, there are similar types of protections in the Medicare program, but the biggest protection of all in the Medicare program is it's not a mandatory program, and basically you can just leave the HMO and go to another one or back to the government-run original Medicare program on a month-to-month basis, and that's what many people do.
Thanks to Chris Molnar and Joe Baker, and especially to the members of our studio audience for joining me. I want to encourage anyone who wants more information about managed care to call the Managed Care Consumer Assistance Program or the Medicare Rights Center for more information or one-on-one assistance. I'm David R. Jones, and this has been the Urban Agenda.